Good morning, everyone. Welcome to Lighted Red, another podcast series, a joint initiative by NATCO and Voice of Healthcare team. You all know Lighted Red is a podcast platform where dedicated to spreading awareness, sharing stories, and also bringing hope to everyone who has been impacted with different kind of blood disorders and blood cancer. And every year, millions of people around the world are diagnosed with conditions like leukemia, lymphoma, and myeloma. Yet too often, signs and symptoms are ignored today. So today we have Dr. Shilpa Gupta, renowned hematologist and cellular therapy specialist from Holy Spirit Hospital, Mumbai, to understand and explore what actually the blood cancer means. And also, she is here to share her knowledge and expertise on diagnosis, treatment, and in blood cancer as we explore multidisciplinary care and clinical research in shaping up the future of the blood cancer therapy. So it is always honored to welcome you, ma'am, to Lighted Red Podcast. Good morning, ma'am.
Good morning, Sundeep, and good morning to all the listeners and viewers out there.
Yeah. So when we talk about blood cancer, ma'am, sit on to the basics. What is actually the blood cancer, and how
Mhm.
does it differ from other forms of cancer?
Right. So, what do you understand by cancer? Basically, cancer is overgrowth or uncontrolled growth of the cells in the body. Now, when the same thing applies to blood related cells, there are three types of blood cells basically RBCs, WBCs, and platelets. Whenever there is increase, most of the times it is commonly in the WBCs, and when they increase uncontrolled, that is called as a blood cancer.
So what are the main types of blood cancer, ma'am? Generally, you see.
Yeah, so the main things that we deal with are either we categorize them into myeloid or lymphoid, as in coming from the myeloid categories or the lymphoid categories. So, most commonly that we come across are leukemias, lymphomas, myelomas, myelodysplastic syndromes, myeloproliferative neoplasms. So, these are the common ones.
Okay. So you said about lymphoid and myeloid. What is the difference, ma'am, to understand?
Okay, so to explain it to you, there is a stem cell. Okay, there is a cell of origin. Like first thing which comes is a stem cell. That stem cell can differentiate into different types of cells. One is a myeloid lineage, and one is a lymphoid lineage. Okay,
Okay.
myeloid, these are the types of WBCs. Lineage, as in there are certain cells when you have an infection in the body, there are, if it is a bacterial infection, then certain types of cells will try to protect your body. If it is a viral infection, certain other types of cells will try to protect your body. So in bacterial infections, it's mainly the neutrophils which get activated, which is from the myeloid lineage. And in the viral infections, it's mainly the lymphoid, which is coming from the lymphoid lineage, lymphocytes.
Okay. Okay.
Yeah.
Thanks for throwing light on that for the audience, ma'am. And generally, who is at risk, ma'am, for developing blood cancer?
So there is no hard and fast rule but as the age increases, we become more susceptible to develop cancer. That is true for any cancer, but that is not dogmatic. It's not like this is the way it is going to happen. Even the children develop cancer. So it's basically dependent upon harboring mutations. If there has been a family history, strong family history of cancer, then there may be some germline mutations which they are carrying right from hereditary. So, but that may or may not manifest as cancer. In certain somebody has already received cancer treatment, for example, has undergone radiation therapy, chemotherapy. Certain chemotherapy agents itself can uh, promote cancer or help, develop, make the body develop cancer. So that is also, there are some like smoke, obviously smoking is related. Certain occupations like people who are exposed to pesticides, certain chemicals in the factory, they can be more at risk of developing cancer or blood cancer.
Okay. So when we talk about the incidence or the trend, so
Mhm.
what are the trends you are observing in recent times in blood cancer in India? It's
See,
increasing
overall,
or
the incidence of cancer has increased. That I think any common person can tell that, right? So probably what we are seeing now, even the blood cancer is increasing proportionately with other types of cancers. And it may also be attributed to the fact that we are able to diagnose it more often now. Earlier, maybe we could not diagnose it also on time, and then we did not know the reason, and we did not know that this was cancer. So now, probably that is also contributing to the increased incidence.
Okay, well, catch up on that. And has there any change in the age group, or ma'am? Generally, you told we have discussed about risk. If you want to elaborate, is there any particular age group for different types of cancer, blood cancer?
Right, right. So, yeah, see, blood cancers is a huge category. Okay, so it encompasses a huge lot of varied diseases. Now, there are certain cancers like acute lymphoid leukemias, which are more common in children, adolescents, child and adolescent age group. And the same cancer has a second peak, which happens in the older adults also. Now, there is another cancer called Hodgkin's lymphoma. Again, it has a bimodal peak. It has a peak in the early age group, which is adolescents and young adults, and then another age peak, which is in the elderly. But majority of the cancers are cancers of elderly, but it's not completely, again, as I said, hard and fast. I have patients who are all in the middle age, the age of 40s, and early 40s, 50s, who are developing cancer. But the earlier the age, the better are the chances of getting better with the cancer, getting rid of the cancer.
Okay. Ma'am, if a person from the same family had got blood cancer and his offspring in the coming generation, should
Mhm.
they undergo any test like that? Anything is there, ma'am?
No, as of now, it is not mandatory. There are no recommendations. But as I said earlier, when we discussed one question, in which there is something called as germline. So if there is now we have multiple better techniques to diagnose what is causing blood cancer. So there is something called as VAF, or variable allele frequency. So if that VAF is higher, as in if it is more than 50%, in those cases, then we test for germline. We test that
Yes.
whether we test the families also, that whether they are also harboring similar mutations which are not manifested. So in those cases, we have to be careful. But as of now, there are no recommendations to undergo screening as such for the family. Like, for example, in breast, it is clear guidelines are there for BRCA mutations. There are clear guidelines for the family to be tested. That is not the case with blood cancers
Yes.
as of.
Okay.
Hmm.
Okay, ma'am. Uh, anyways, we touched upon this diagnosis. So, is it early detection is so crucial in blood cancer cases?
Yes, obviously. Now, it all depends upon the type of blood cancer that we are dealing with. But yes, in general, if earlier the detection before the complications occur, better are the results. Now, there are certain cases of acute leukemia where we cannot do anything and they are detected at a particular time. We do not have any screening and they are acute. They develop very fast and they progress very fast. There are certain cancers like lymphomas. Lymphomas are relatively slow growing. So the moment if somebody notices a lump, they can approach the doctor and get it tested. Another case is that of a
Okay.
myeloma. Patients are lingering on with the back pain for a really long time, visiting orthopedician, not getting any relief for the back pain. If those back pain patients are tested early for myeloma, just to see whether there is that M protein which is there, which causes this, it can be detected early and treated in a better way, definitely. So, mass education of the general practitioners, all these things are important to get those testings done on time.
Okay. Okay. And uh, early signs and symptoms, you already mentioned low back pain. And any other thing apart from this? Any signs?
It all depends upon other, again, types of cancer. So in leukemias and all, we have mainly easy fatigability, easy bruising, as in you get some marks, like in something somebody has hurt or somebody's got hurt, those kind of bruising marks if you get more frequently, if there is more fatigue, if you recurrent fever which is not getting settled, and any lumps or this thing in the body, any pains or aches, chronic kidney disease, anything. I mean, these kind of things. First thing
Okay.
is listen to your body. If anything is happening little differently than what it was, it's better to get checked.
In the case of children, also it goes with like that only, ma'am, for lymphoid leukemias.
Yeah, yeah. I will just be clear that I don't treat pediatric patients. I treat all above 12. I am an adult hemato-oncologist. But yes, in pediatrics also, it is usually the same scenario in which, they present with failure to thrive, loss of weight, loss of appetite, falling
Mm.
hemoglobin, bleeding symptoms. All these are
Mm.
usually what happens in children as well.
Okay. And what are the general screening recommendations you go with, ma'am? Only complete blood picture, other than that, everything.
Yeah, so there are no guidelines as of now for screening for blood cancers. There is nothing like a regular checkup the way it is done for prostate and breast. It is not recommended for blood cancers. So, because it's a very big gamut of diseases, we don't have one disease, and very different mechanisms, very different treatment for each blood cancer. So, it becomes difficult to screen everyone. You just do a CBC. CBC cannot detect many blood cancers because it comes from the marrow. By the time it comes in the blood, it has already progressed quite a lot. So that is not subtle signs, and all those have to be kept in mind. Yeah.
Okay. And in your keeping into your expertise and experience into this, so how common is delayed diagnosis, ma'am? How common you find out in your patients?
Oh, it's in India especially, it's very common. As I told you, patients are lingering for months together with some back pain, with some node here and there. They get treated for TB. We published a recent paper where the patient had a lung mass. I mean, there was some fluid in which the pleural effusion is always taken as if it is TB, and it
Oh.
was treated as TB. Patient lost around 8 to 9 months in just getting treatment for TB without any result. And then when we investigate, it comes out to be a lymphoma.
Yeah.
So, this is a very common scenario in India. So, TB, because being common, it results in a little bit of misdiagnosis and missed diagnosis, basically. And
Okay.
sometimes patients have more faith on alternate therapy also. So that also is a big problem for us. Sometimes people start seeking homeopathy care or Ayurvedic care. I don't say that they do not work, but the diagnosis is delayed once, we lose that time when we have uh, this kind of cases where we need urgent action and immediate treatment.
Okay, ma'am. Before going to the treatment and innovations,
Mhm.
in movies, if you see a hero or actress or actor, such a dramatic way they show blood vomitings, everything, and they
Mm.
they go to the clinician or the doctor. He says we don't have money days. Is it really such a dramatic situation in blood cancer, ma'am? Just for audience.
No, most of the things that you see in movies are not right. Obviously, it's a wrong portrayal. I mean, you need to understand it in this context. But yes, it may not be that dramatic, but there are cases where it does happen. Hematomesis is a common symptom. Vomiting of blood is actually not commonly seen in blood cancers. There are other diseases where that part is more common. In blood cancers, majority of the patient, they present with the symptoms which I mentioned earlier, rather than such dramatic. But yes, one odd cases it can happen if the patient has very low platelets, very very sick. So that's it can happen, yeah. But obviously, don't go by the movies.
Okay. Okay. Coming to the treatment aspects, ma'am, who has been the treatment landscape if you take last 20 years or last decade? How it has
Yeah.
been evolved in blood cancer?
So I'm involved in blood cancer treatment since 2009, exclusively
Okay.
blood related disorders. So I have seen things changing so dramatically. I mean, the landscape, especially of blood cancer treatment, has changed it has changed dramatically. That is an understatement. So there were some drugs which earlier the chemotherapy was the only solution to the drugs. I mean, to cure blood cancer, and the cure rate was also less. Now we have gamut of therapies like biological therapy, immunotherapy. Now what is coming into picture is the new CAR T cell therapy. So much is development is happening that probably in the next 10 years chemotherapy is going to be redundant. Already we are
Okay.
going towards that.
Can you throw some light on this immunotherapy and also this CAR T cell therapy, ma'am? What is the
Yes, yes, that is, yeah, yeah. It will be a very good thing to talk about. So, I'll just tell a basic difference between chemotherapy and cellular therapies. Now, what happens in chemotherapy is there are some toxic agents, there are some medicines, injectables or orals, which are known to kill the cancer cell by some mechanism, causing their cell death and kill the cancer cell. What happens in the process of killing the cancer cells is they kill the other cells also. So they kill the skin cells, the GI cells, the gastric, any cells which are coming in their way. Everything will take up some amount of chemo and show side effects. That's why you get hair loss, you get loose motions, all those diet, everything, all the side effects related to chemotherapy. But immunotherapy or biological therapy, when it started with that, it took away this component and it became more targeted. Targeted as in it will just take care of the cancer cell and hold on to the side effects of the bystander cells. I mean, whatever are the cells other than cancer. And now comes CAR T cell. Now, what is CAR T cell? CAR T cell is basically you are taking out the T cells, your own T cells. T cells are the lymphocytes from your own body, and you are teaching them, you are tutoring them to fight against the cancer. Okay, you take them out, you teach them by putting a chimeric antigen receptor on their surface,
Acha.
and that is supposed to go and identify something on the tumor cell, only on the tumor cell, and kill the tumor cell by releasing certain chemicals. Such a sci-fi thing, it is actually working. It is even taking care of the patient who have been refractory to other lines of treatment, who have lapsed on other treatments. Even in them, it is so.
Okay.
This is
And
basically.
when we talk about this bone marrow transplantation, ma'am,
Mhm. So bone marrow
what
transplant.
what actually happens in bone marrow transplantation?
Bone marrow transplant. So I mentioned you take out T cells in CAR T. In bone marrow transplant, you take out stem cells. Now, bone marrow transplant can be two
Hmm.
types. Either you do it from the patient's own cells, or you do it from a donor's stem cells. So, right in the beginning, when you asked me a question, what is myeloid and lymphoid, I told you that there is a stem cell which differentiates.
Steps.
Stem cell. So that
Differentiates.
stem cell is what is responsible for stem cell transplant. So we collect these stem cells either from the patient themselves, or we collect them from a donor. When we collect it from the patient itself, it is called as autologous transplant. And when we collect it from a donor, it is called as an allogenic transplant. So there are certain cancers for which these things the transplant works really well, especially when the cancer comes back. Transplant remains usually the only solution for blood cancers. But there are toxicities associated with it. There are, because we are sometimes taking it from a donor, the donor cells can react with the host cells and cause something called as graft versus host disease. But now things are moving so fast and swiftly and towards a safer transplant, that graft-free engineering, improvement of GVHD prophylaxis, all these things are changing the transplant arena also to quite a lot of extent. So we can, in the next 10 years, there'll be a paradigm shift in the treatment of blood cancers. Much more safer, uh, much more better results are expected.
Okay. Ma'am, I think you have enlightened us on the treatment and the way the blood cancer has been evolved. But in India, two things will come under very quick, mean to say accessibility and affordability when you talk about as
That
per the
is,
Indian economics. So, what are how does they are accessible, ma'am, or affordable to the patients?
yes, yes. So, uh, what I would say in the last 15 years, what I've seen is a gradual increase in the affordability, definite increase in the accessibility, but still we are far to go. I mean, we still have a long way to go. It is getting better. Patients can afford treatment. Patients can access treatment to better extent. But again, when we go to tier two, tier three cities in India, then things do get a little difficult. So many patients for blood cancers have to move from there, come to a metropolitan city for a treatment. So all those things have to, there is still scope for improvement, a lot of scope.
Okay. Ma'am, do you find any or what are the common or biggest barriers to quality blood cancer care in India, as per your expert opinion?
Yeah, so the biggest barrier is infections. It is extremely sad part of it that blood cancer patients, their when we treat them, their WBC counts, their overall immunity and everything falls to very low level. And when that happens, they need to be treated with good antibiotics, and uh, they get multiple infections like gram negative and
Mm.
gram positive bacteria. What is happening in India, which we don't get so much in outside countries, is that we are not able to control these infections timely, or our antibiotics are failing in controlling these infections because of the antibiotic resistance scenario in India. So that is one sad state of affairs. Many a times when I counsel the patient upfront, I tell them that, I'll be able to take care of your cancer, but you have to prevent yourself from infection. If you get a bad infection, then I'll lose the battle. And that is a very sad state of affairs.
Okay, ma'am. Coming to the psychological impact of the patient, or
Right,
what
right,
kind of
right.
emotional and psychological challenges do blood cancer patients face? Because cancer is not only a word particular to that particular individual; it affects entire family. So, how does you
Absolutely.
counsel those kind of patients, ma'am?
Yeah. Yeah. So it is traumatizing initially when you come to cancer itself is very difficult, but the moment you come to know blood cancers, it becomes even more difficult for the patients to digest. It's extremely it requires hours of counseling. Initial diagnosis, it requires hours of counseling when the patient is initially diagnosed. So the family has to sit. They many a times we sit with the families, and then first we let the families get to accept the situation, and then when things are better, then we go on to the next step of counseling and telling the patient. And it does happen. I mean, they go through those phases. There are phases of psycho-oncology. There are 5 phases, first being denial. So they all go through those phases. But ultimately, with the help of our staff, with support groups and everything, we patients
Caregivers.
are able to overcome this difficulties.
And as per your opinion, ma'am, as there are enough rehabilitation or survivorship programs in India, ma'am, for blood cancer patients,
Not
or
enough.
still we are in developing?
Yeah, we are still lacking back in that scenario. We do have patient support groups, but not everybody is aware. Not even the doctors are not very much aware of referring the patients to the support groups. But one thing which is good in India is we still have that family bonding. We still have families that are stuck together. It's rarely, nuclear setting or isolated. So usually the family is with the patient. So that itself becomes easier for patients to deal with. They don't have to go outwards to look for support system. But yes, as we move forward, we need more strengthening of support groups and rehabilitation centers.
Okay, ma'am. We already discussed a lot of things on this behavior of the patient and other concepts related to the patient, but still, uh, the word itself, the emotional concept, and the psychological impact also we have discussed. But putting around a different way, do you find or do you see still there is a stigma or a misinformation surrounding blood cancers in your
Absolutely.
practice?
There is people, not everyone, people, many a times people don't want to disclose to their
Mm.
society that I have suffered, because, and many a times it's, if young people, because it does interfere with the quality of life. People sympathize or they give unnecessary suggestions. So all those things do come into picture. So stigma is there. Uh, that requires a change of mindset overall, which is a little difficult, but let's hope and see how things go.
Okay, ma'am. And one last question from audience side or general, what strong message you give to the patient, mean to say blood cancer patients? Strong advice or a message?
Yeah, yeah. So I always say this word, cancer is CANCER. There is always a can in cancer. So, and it is now, there is definitely more space for that. So, it is possible that we can treat, we can get the patient completely cured of the cancer. So, it is possible. Please don't lose faith. Please don't lose hope. It is very much there.
Thank you, ma'am. Thanks for your valuable time and
Thank you,
sharing your
Sundeep.
valuable expert opinion on this stage of Lighted Red podcast series, ma'am. And you have been taking us through what actually the blood cancer means, how does we differentiate it. You have touched upon the signs and symptoms, diagnosis, everything, and also the misconceptions which is roaming around the blood cancer itself. Thank you very much, ma'am.
Thank you,
It's
Sundeep,
always
for
been
that.
honored to share your knowledge on this platform. Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you.
Have a
Thank
good.
you very much. Thank you, NATCO, as well. Thank you.
Thank you.